Welcome back to Wedlocked and Loaded.
Wedlocked and loaded.
You women.
Do not lump us all in one category.
So you girls, and lie and stretch the truth and try
girls,
to get us jammed up.
First of all, I'm a whole ass woman, right? Think about
no
that.
No disrespect.
Sounds like it to me. So why can't y'all? What is it with men that they just can't walk away?
Depends how good it is. You don't want to give that away.
Greetings, ladies and gentlemen. New episode of Wedlocked and Loaded. I am Daniel Laurent.
And I am Leah Nicole.
And we are joined by a special guest today, Dr. Joe Pash. And we always want to be entertaining, but also informative and go into different spaces that people may be a little afraid to talk about or be transparent. And so I think that this was a great opportunity because this is something that as men is always kind of an underbelly conversation, right? And you see like signs and billboards, does size matter? And there's always, little jokes and puns and things like that. So we're going to get into a development that can absolutely help men out there. And I won't say men who are challenged because I think, it is what it is. We'll get into it. So anyway, do you want me to call you Dr. Pash, Joel, Dr. Joel?
You can call me Joel for the purposes of the podcast.
All right. So Joel, welcome to the show. Thank you so much for coming on. And I think it's important to always, instead of like reading like a bio and it's all this type of stuff, I think it's important for you to explain like your journey and what got us into this point before we start delving into the Q&A of what we are really going to talk about. So can you just kind of explain your journey, what got you to this point?
Sure. I started out as a management consultant about 25 years ago. I ended up going into medical school and became an anesthesiologist. So I finished my residency in 2011. And between 2011 and about 2022, I was working as an anesthesiologist, which is, pain medicine and making people unconscious for surgeries. Within that, we do quite a bit of procedures, like a lot of injectable procedures like nerve blocks and, as women know, epidurals, spinals that they'll have during childbirth or pregnancy. And we do nerve blocks, which is injections into nerves for pain control. I went on this journey and kind of midway through COVID to try and expand my practice and find some other things that I could do besides for anesthesia. And I came across penile filler, and it fit quite nicely into what I do from a procedural perspective, because actually injecting penile filler is similar to doing other injectable procedures that I do. So that's from the actual kind of procedural and medical standpoint. From the perspective of it being men's cosmetic procedure, I saw a big opportunity to do for men what has been happening in women for 20, 30, 40 years now. It's fairly common for women to get cosmetic surgery, cosmetic procedures done. As you know, Botox and fillers are really big right now. And many women have had breast implants and butt implants, but it's not a thing that guys have been doing. Obviously not butt implants and breast implants, but in general, this is a area in medicine that men have not really been part of yet. And what we're finding is that it is something that men are interested in, but they either didn't know about these things or didn't know where to look or didn't know where to start. So when I found out about the possibility of doing penile enlargements using filler, it was kind of a good opportunity to get in there and see what we could do for men that their partners and other women are already getting done.
So, well, so I want to, and I should have said this in the beginning. So, and as I told you before we started, I did watch the other interview that you did. So I want to just let you know. So it's up to you. This would be like an uncut interview, right?
Okay.
So, an uncut conversation, I'll say. It's not so much an interview, but just an uncut conversation. So if there's certain things that you want to say, because I remember there was, you said something, something, and they were like, "Oh, you know, you didn't have to say that. We got the gist." So whatever you want to say, just say it and let it fly. Because
All right.
this
Yeah.
one,
There's a lot of good things to say and a lot of good
Yeah.
stories. So
this one has a
we'll
potty
make sure
mouth,
of that.
so you know you're safe. I just wanted to make sure. Sorry,
Anyway,
I'm done.
so good. So when you say fillers, can you elaborate on that just a little bit? Are you, yeah, can you elaborate on that? You know, 'cause I
Yeah,
know,
so I probably should have got started there from the start. I'm the CEO of a company called Upsize, and we use dermal filler to increase penile girth and sometimes a little bit of length. So the way we do that is we use hyaluronic acid dermal fillers. So traditionally, if you wanted to have a penis enlargement, it would be surgical, or it would be some kind of thing like it's basically a scam, like a pill or something that doesn't work. So we came across some other doctors and some studies and articles and trainings and stuff where we realized we could use dermal filler injected into the penis to increase the girth. So this dermal filler that we're talking about is the exact same filler that if you're a woman you would get in your lips or in your cheeks or
so like a plumper.
yeah, exactly. So you can imagine the same way that it makes your lips bigger, it can make your penis bigger.
Okay, okay. So no fix a flat, no, but it's similar to like a, you know, just a no BBL, so no fat transfer, but just a filler in terms of, like, it just plumps up.
Yeah,
Like
so
a
there's
natural plumper.
exactly like there are there actually is a procedure that you can get done, which is a fat transfer. But the issue, so there's a lot of issues with other penile enlargement procedures out there.
Right, but
Pretty much everything.
we can talk about what you are doing, not what other people are doing that is not working.
Well, I think, well, to that point, yes, I want to focus on yours, but I think to the point of, because with the good and bad about the internet is you Google penis enlargement, penile enlargement, and you get all this stuff, right? So I think qualifying because it's not a matter of opinion. I think qualifying, blah, 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 maybe not spending so much time on it, but I think it's important to, yeah.
Yeah, I mean, I will tell you that the typical guy that is looking to get some sort of enlargement done just assumes that it's a surgery that you're going to need. And we would be doing a disservice to all men if we didn't at least briefly talk about some of the risks of the traditional surgeries, because most of them are quite risky and we see quite a few side effects. And I've seen guys like come very close to actually losing their penis or and common to have like permanent injury and disfigurement and stuff like that. So I mean, we can leave it at that, but definitely beware if you're looking at penile enlargement and make sure that what you're getting done is safe and has a good track record, and that the doctor that's doing it is experienced and has gotten good results. Now, back to what we do. What we do doesn't tend to have any of these risks because the filler that we're using is completely dissolvable. So in the event that there was a complication, which in itself is incredibly rare, it can actually be dissolved using enzyme that's injected, which is the exact same thing that happens when they inject into your lips or face. And the other thing is the layer that we're injecting the filler in is not really near any
Major nerve.
kind of critical, dangerous structures. So it would be very difficult to damage anything. It's more like we're working underneath the skin than in the actual functional part of the penis. And so because of those two things, we don't really see any serious any complications at all. And it's very safe. The filler works nicely to accomplish what we're trying to do, because just as it's called, it is a filler, and it makes anything that you inject it into thicker.
Okay, so let's talk about how thick we can get it.
Yeah. Good question.
Yeah, how thick can we get it?
Sorry, Joe.
Well, the limitation is basically how long it is, right? Because you don't want a tuna can, right? You don't want you want a soda can.
Oh yeah. Right.
So, like basically, if let's say, so short answer to your question is you can get it as thick as you want.
Hello.
The average thickness when someone comes in is like
this.
I have it. So that's probably like 8 inches around if you were to measure it.
8 inches around.
Yeah, like the circumference. I have a guy that's gotten to about 7 inches.
Wow.
All right.
So just for reference, and
what did he start with?
Probably like 5. So it's not uncommon. So I think the average is like 4 or 4.5 inches when flaccid, and it's pretty reasonable to add an inch and a half, and even 2 inches.
I gotta get my measuring tape.
She's going to get
get the measuring tape.
So that's what it was. When you said flaccid, penis, and she was like, no, we could have just said flaccid, and that would have been fine. That's what it was.
All right.
Yeah.
So for reference.
Oh, so they were worried about being on YouTube because I think.
Oh, I see.
It's like it's Google, they.
Exactly.
So for reference.
All right. So
flaccid.
So she's actually
5 inches. I wish I had something to.
Yeah. So that's that. I would say 4 to 4.5 is average.
Okay.
Starting.
So we'll go 4.
Okay.
Flaccid.
Is that about right?
What is the problem? You can see it.
I can see it, but I don't know if my finger is in the way.
He can see it.
I'm sure he knows what it looks like, but this is for the people.
Yeah, it's clear.
Okay.
I mean, put it closer if you want.
All right.
Oh, you want something like in comparison?
Absolutely.
Okay.
So yeah, if you take that 4 and then make a 7.5.
7.5. Oh, Jesus, 7.5. All right, 7.5.
It's like the Dolly Parton of penises. No.
And this is this just the tip, or is this
Well, the goal is to do the whole thing.
Oh, but a lot of okay.
So that's the side. That's what you got it to.
So this is 7. This is 7.5. So see.
Yeah, like I said, 1.5 inches. It really depends on your starting size too, right? Like if you're starting at 6 inches around, then I can get you to 8.5 or 9.
So you can go up to about 2.5 inches wide, thicker from your starting size.
Yeah, that's probably the upper limit. It gets to the point where it doesn't look right.
Yeah.
Like back to the tuna can analogy.
Yeah.
But yeah, I would say the average guy that comes in is about 1 inch, ends up about 1 inch thicker. The guys that kind of go all in, it's more like 2 inches thicker, and then there's the outliers that are 2.5 or 3 or whatever.
Okay.
Now let me ask you, and there was we're kind of like, we are kind of like veering off because we did have like a structure of questions, but we're just going to let it be organic. Is it a situation? So this isn't permanent, right? So there's maintenance involved. Same with filler. You'd have to come in every, what, 4 to 6, is it like 8 to 12 weeks?
No, it tends to be more like 2 years in the
Really?
penis. Yeah.
Calm down.
Yeah, the lips have quite a bit of blood supply.
Yeah.
So they're very vascular. The penis is like in the deeper structures of the penis, it's pretty vascular, but where we're injecting it, it's not. And so there's not a lot of chance for your body to break down the filler. So it definitely is temporary and it's slightly different in everyone, but we tell people about average 2 years.
And it doesn't matter how often it's being used.
No, it shouldn't. It's a little different in everyone in that everyone's biology is a little bit different and everyone has different level of enzymes in them that break it down, but it's not, using it a lot in itself is not something that should make it last.
So I have the question I have written down, but I want to ask you this before I get to that question. So if a person, as just previously stated, wants to go rogue and go tuna can, right? And then after going home and realizing this is kind of crazy, like, can they come back and kind of like deflate the tire a little bit, or are they stuck for 2 years with this?
Yeah, so you could deflate the tire. I have one patient I can think of that he's kind of a player and he kept coming and getting it bigger and bigger, and it just got to the point where it's ridiculous. And he actually had like some women that were like, no, that I'm not touching that thing. And so he came back and we had to like make it a little bit smaller.
He might have just wanted to hear that though, because as a guy, you know what I mean? Like, that's too big for me. It's like, yeah, so he might have just wanted to hear that. Now he can go back and get some adjustments.
So
I think it's like, yeah, thanks. Right. But then at the end of the day, it's, it's a compliment, but you still aren't using it. So,
yeah. So in this case, right, like, how does this work? Is it similar to, does it, I guess, does it go back without any issues, right? Like muscle memory, or, does it have just like a little extra hanging skin since it's,
like a person that got liposuction, that they have the extra meat hanging off. Is that
it doesn't really tend to do,
but not like that.
I think I know what you're saying. It's like, when people gain a lot of weight and then they lose a lot of weight, the skin stretches out.
Right.
So the skin in the penis is quite, there's quite a bit of space in there. If you think about a flaccid penis, there's room, like when it's hard, there's not room, but people aren't walking around with an erection all day. So when it's flaccid, you have a lot of room to be able to stretch things out and not cause that issue. So no, that's not something we see, but basically your body breaks down the filler linearly. So it's just it's just constantly breaking it down, and eventually there would just be none left.
Right. So I was more so referring to the player who overinflated and had to, come down a few notches.
Oh yeah, no, you can't tell. You just dissolve the filler and it goes back to normal.
Wow.
All right, so you jumped my question. So my question, so similar to filler. Well, yeah, I'll ask this. So similar to fillers, and injectables and things like that, it's highly recommended to go to board certified physicians, for various reasons. When it comes to this with penile injections, because the problem is once something is known, you have like everyone doing it. So now you can go to a nail salon and in the back they're doing it, right? What do you say to a person that is thinking about this, and what should they look for? There are letters behind the name that kind of tells people these are legit. Is there certain certifications? Like, what would you say to that?
Yeah, I think that's a really good question, actually. Like as you alluded to, as this gets more popular, kind of everyone's popping up and doing it. What you see is a lot of med spas that kind of offer a little bit of everything, and it's like, yeah, we do penile injections too. So, yeah, obviously, if you're a hairdresser, you shouldn't be injecting penises, but let's assume that you're like at a minimum, like a nurse or a doctor or even a physician assistant or something like that with actual medical skill. I think the most important thing with anything in medicine is how many have you done? Um, Anyone can put up a sign that says they do it, but it's like, have you done 2 in the last year, or do you do 7 a week, right?
Yeah.
And most people that do this don't do that many. There's kind of a few big players out there that do most of everything, and then there's a bunch of people that I would be surprised if they do 1 a year, but they advertise that it's like one of their services.
Yeah.
And then obviously, yeah, like you can make sure that you can look at their medical specialty, and if they're a psychiatrist, they kind of do less procedural stuff than if they're an anesthesiologist or a surgeon. But having said that, there's plenty of doctors and nurses that are very good at what they do, and it's not necessarily to do with what your training was in medical school or residency. It's because we don't learn this in residency.
Right.
So it's more about what you're doing now and how many you're doing and what your results are.
Right.
So,
yeah, I think.
A question?
No, well, I'm sure I do, but
we have a nurse practitioner that works with us, and she's not a doctor, she's a nurse, but she's been doing injectable procedures for 30 years, and she's most certainly done more injections than any of the other doctors I work with, just because of the amount of time that she's been doing it, right? So she's very good at what she does, and the fact that she's a nurse rather than a doctor isn't necessarily a big issue. But again, it's just the amount and the skill in general.
Right. And I think it's always important to state, although you probably it feels like you shouldn't have to, right? But before you look to have any medical procedure, you should always do your research. Just in terms of the doctors, just in terms of the space. Like if you're going to Sally's Kitchen, you probably should think twice about that, right? Yeah. As opposed to going to an actual facility. If you find that this facility just opened up and this, these doctors, were just certified yesterday, that's probably a red flag that you should pay attention to and say, especially if they're offering a 2-for-1 special, right? Like,
yeah.
So, there's things that, you should look for as an individual to protect your own self.
Yeah, absolutely. The easiest question is, how many have you done? And either someone's going to lie to you or they're going to tell you the truth. And if they tell you the truth, then, which I hope everyone does, then you just need that number, right? And then it's like, okay, I've done 100. Well, let's see some pictures.
Yeah.
What do they look like? How many complications have you had?
Right. So those are the questions. How many procedures, how many complications, portfolio, because you should always have that, your befores and afters.
Yeah. So, and I was going to say also, you can Google these things.
Absolutely.
Not necessarily Google the doctor. I mean, you can Google the doctor, but you can also Google penile filler complications, penis enlargement surgery complications, penile fat transfer complications. There's a lot of information out there, and surprisingly, I see who contacts our office, and I can read the phone transcripts and the text message conversations, and it's really surprising how little research people do.
Yeah.
Like, I just want to get my dick bigger. And
right. Exactly. Because I just want to bang mad chicks.
Right. But all you had to do is Google it. You don't know that.
That's not like it's not like a bad thing. You're saying it as if it's like, anyway.
Women are a little like more savvy than men in that department. Like there's men are just like, yeah, whatever, just first doctor that'll inject my dick for the cheapest, like I'll go to that guy, right? And then
well, no, women too, with the BBLs and going in the basements and getting filler tires and plaster.
Can you relax?
I'm relaxed, but people that's getting like the plaster and the glue in their bum and all that type of stuff. People are looking for deals across the board.
I think people are looking for deals across the board, but I think what it is that you are referring to people. You're thinking about, when surgery first started, these types of surgeries first started, right? Like there was a lot of shame and secrecy behind it. So the back alley deals were prominent in that way because of the shame and the secrecy behind it.
Shame and affordability for both.
Well, affordability for certain.
I think it's probably 50-50. And with this, I would feel that the shame. I think because the surgery and the enhancements alone are just it's out there now. It's not. I don't think that there's shame to any of it at all now. For sure, there is. What do you say? Do you think
there's like two kinds of guys that come see us, right? There's some guys that just they're already more than adequate and they're just trying to have fun and get it bigger, and there's no shame there. There's really no shame in any of it. But then you do have guys that are like on the smaller side, and they're there because they have like either a self-esteem thing or more of what they perceive to be a problem rather than just trying to have fun and get a bigger dick. It's not that I see shame in the office, but because I don't really, but sure, people they don't want to like wear the Upsize clinic shirt on the way out. And
right.
I
just had my dick enlarged. Can I ask you a question? Because I feel like we talked about more of the circumference, right? About girth. In terms of getting the length, is it the same? Can you extend the penis about 2 inches as well?
No, and that's the thing that people get into trouble with. It's very difficult if you think about the way that the penis like shrinks and expands all the time.
Yeah.
Just intuitively, like you can inject stuff around it, and it can shrink and expand, and that doesn't that doesn't cause any problems. But the procedure and the filler is what it is. It makes things thicker.
Right. So does it stay thick when it's flaccid? I'm sorry, I have
it stays thicker. It's just like you're putting the material in, and it's just always thicker.
Oh, wow.
The issue is that some of these procedures that are not filler that try to increase the length, they're actually have to implant something in there that is physically actually longer than the penis.
And that's where the complications come in.
Yeah, complications come in, number one, just because when you implant anything, it can have complications now. But the difference between like a breast implant and a penile implant is that breasts don't like shrink and expand all day.
Right.
But the penis does. So what happens is you implant something in there, the penis shrinks, expands, shrinks, and expands. It kind of rubs against the implant. And eventually what happens is it'll erode through the skin. And that's like obviously really bad.
That's not fun on a Saturday night.
No. And then these people end up getting it removed and put back in, and there's scar tissue and all kinds of stuff. So it's like, on the topic of just doing your research, just do your research, right? You just Google that and it would be the first thing to come up, but people don't do it. But yeah, in other words, it's very difficult to make the penis longer, if not impossible.
Now let me ask you, and I don't mean the external pump, but is there an actual surgery where you can get almost like you remember the Reebok pump sneakers?
Yeah, so there is. I know what you're talking about. There's penile implants that are designed for erectile dysfunction. And so those go in, they're implanted in the corpus cavernosum, which is the functional part of the penis that it shrinks and expands. Those actually, believe it or not, make the penis shorter.
Yikes.
Anytime you kind of cut around in there and whatever, you cause scar tissue and things kind of all contract, and so it does work for what it's meant to do, which is to get an erection. Like, it's for people that can't get an erection, they pump it up, and now they have an erect penis. But
Pump it up. Sorry.
yeah, but we actually have like a lot of guys that contact us that have those, and they're like, can you make it thicker or make it longer? Because they've either lost length or maybe they thought it was going to increase their thickness or something, but it doesn't. And
So
that's
do you work with people who have ED?
Yeah. So we have patients that have those implants in, and we can inject around them, so we can still make it thicker. A lot of guys have ED, right? Especially once you get into your late kind of 50s and 60s, even younger guys do.
Even younger, yeah. Unfortunately,
I mean, the way you're like testifying.
you're fine. Don't worry.
Thank you.
Jeez. I'm just in a lot of.
You hear how she's like, yeah.
I see a lot of unhappy wives.
Oh, look, I'm glad you, because that was gonna sound a little crazy.
Yeah.
I see a lot of, Sorry, Joel. You see how this goes.
Yeah.
Whatever.
Cheers.
Yeah, well, we could bring my wife out here too. It'd be probably a lot worse.
So I wanted to ask you. So let's put an end to this myth. So if you're looking to get more girth or more length, and you want to run out to CVS or Walgreens at 10 o'clock at night, that doesn't work.
That most certainly does not work. I think at best, if you take one of those pills, you might get an erection easier, which, indirectly, I guess, gives you a bigger penis, like, while you have the erection. And maybe there's some crossover between guys that have small penises and have ED, like we talked about. Not that the two are related at all, but just a lot of guys have ED. So, in that sense, it might do something, but it might do nothing. It might also be dangerous because, for the most part, these medications, we don't really know what exactly is in them. It's not controlled the same way that actual prescription medications are that are FDA approved and all that. And so, I mean, personally, I wouldn't take any of that stuff. We now, and just to, then you might ask, well, is what we're injecting in the penis a medication, right? And it is actually. So the medication or the filler that we inject is an FDA approved product, which is also used in the lips. Now it's indicated for use in the face. And so as medical people, we can use stuff off label. And so that's what we're doing. So it's like a FDA approved product. It's shown to be safe and effective and all that. And then we use it in an area that itself has not been like studied the same way that it has in the lips, but it's kind of an intuitive thing more so than anything else. It's like, it makes things thicker, so it'll make the penis thicker also.
So can I ask? Well, I do have a lot of questions.
Sure.
Clearly.
Is it directly related to what he just said? Because you're gonna bear it off.
Sure, but go ahead if you feel like you have something.
To that point, is there any studies that you are involved in or that you know of that is studying this particular thing to have it so it's FDA? Because what I'm getting from this is similar to what happened with Latisse, right? Are you familiar with Latisse?
No. What's
so Latisse was for, I think, cataract, and then what ended up happening as a byproduct, it was helping your lashes grow more fuller. Okay. So then they started actually marketing it as,
a mascara, a mascara.
Or I guess the more popular Ozempic, everyone's using it for whatever. So is there a study that you're aware of or that you're participating in that is actually for this specifically?
It's something we talk about all the time, but it's very difficult to do. So I don't actually see that happening in the foreseeable future. I think, it's these studies, like, to get something FDA approved, we're talking about tens of millions of dollars.
Wow.
So I think until I think at a certain point in time, it might be like once the whole world is getting this done and it's commonplace, then for sure. But there's not, it's like no one's going to pay for that study right now.
Fair enough.
So as of now, it's working. It's been working. There's been little to no complications. And you have a lot of satisfied customers, clearly, right? Do you see this? Can this work in women who? Can this work in women?
Well, for fatter clips.
Yeah. In terms of like plumping up their lips, so to speak.
Yeah, actually, I've heard of that being done. Believe it or not, the anatomy there is like very similar. Because like in utero, basically, you're depending on if you have an X chromosome, if you have a Y chromosome or not, your body either develops a penis or it keeps you having a vagina.
Yeah.
To simplify things. So the actual like tissue layers are very similar. And so you can inject filler in kind of the same tissue plane in the labia or the lips that you do in the penis. I don't do it, and I'm not aware of anyone that does, but I've kind of like heard of it being done, and you totally could do it.
Nice. Okay.
Yeah, some women like to have like flickers, I call them.
So, well, I think when you get like when you start getting older, all your it like happens in your face too, right? Like a lot of your soft tissue or kind of fat, so to speak, like starts kind of disappearing. So, for example, people's faces when they're older kind of look more thinner and skinnier than younger people.
That's the collagen, right? The lack of collagen.
More plump looking. And so I think the same thing can happen with your labia also as you get older. But it's not something that, it's certainly not as common a discussion point as like a big penis or small penis, right?
Yeah.
So I want to ask you this, right? Because so I want to ask you this. So I'm familiar with the procedure of vasectomy, right?
Yeah.
For this procedure, does it affect at all the ejaculate as far as sensitivity or lack of or more of, or to your knowledge, does it affect anything like that?
No, it shouldn't. This is basically underneath the skin. Okay. So your sensitivity is going to be in nerve endings or in nerves that are in the head of your penis and the skin. So since we're going underneath the skin, we're not really affecting those nerves. And if anything, the sensation and sensitivity gets better because it's thicker. So there's more, it's filling more space, so to speak, right? So you should feel things better. And obviously the partner feels things.
Oh, yeah. Yes.
More.
Leah, go upstairs.
So nice. I just want to know, and I'm sure the people want to know,
Jesus.
How soon after the procedure can the new vet take a swing and things?
7 days.
7 days.
Oh, really? So do you have to wait, or it's just not going to have the full effect? Because I know if you get like, the injectables, I won't say names, but if you get injectables for your face, you can literally do it and then go right to work, right? It's not like
You can go right to work. It's just we ask people not to have sex, mostly like just to prevent complications like infections and maybe like putting a dent in the filler or something like that. But
so it's good to get it like when she's on her period.
Yeah, like a lot of guys, it's interesting you mentioned that. Like, it's fairly common for guys to like come and plan this out. Like, oh yeah, I'm on a business trip next week, and then I get back for 3 days, and then my wife's going to see her parents, and so can I come in on a Sunday at like exactly like 9 a.m. before my flight to the UK or something like that and get this done?
Let me tell you.
Now,
something.
do you accommodate that?
Let me tell you.
Sometimes I do. I mean, it depends. I have certain patients that I've seen a lot of times, and they keep coming and getting more and more. Like sometimes this can be a little bit like an addiction, kind of like similar to people getting tattoos.
Tattoos, that's what, yeah.
Yeah. So I do have patients that I've seen numerous times, and if they call me and ask me to come in on a Sunday, I'll do it. I typically don't do it on someone I've never seen before.
Yeah.
Because, you don't even know if they're going to show up. So, but on someone I know well, I'll do it.
Now, this 7-day wait period, this is for intercourse. But what about oral?
Oh, you got to give him that huck too and spit on that thing. You get me?
Yeah.
Is that the same?
Can she lick the tip? Just a few licks?
You can do whatever you want, but the doctor recommends not to do it.
So no sexual activity at all.
It sounds like childbirth to me.
You know that the mouth is like the dirtiest
nasty.
part of the human body, right? So
Pretty
it would
gross.
technically actually be worse to get oral, but we prefer just do nothing.
But technically, so my Willy Wonka brain says
pretty gross.
No, my Willy Wonka brain says
I get it.
You can like
it's gross.
You can mess with the scrotum a little bit and just at least, you know what I mean?
What's the point?
Just a little bit, because, well, I don't know.
You don't know.
Well, let me ask you this: aside from the intercourse or oral whatever, are you able to safely ejaculate within those 7 days, or is it best to abstain? Period.
Yeah, you totally can.
No, I wasn't asking that.
No. Can you masturbate? Because I am.
Yeah, I usually tell people wait a couple days, because if you're masturbating, you can kind of control where the hand goes, or where you might have a couple little holes that are still healing, and it's just like, don't touch those little holes and then you'll be fine. Whereas if you're having sex, obviously it's a little less exact than that.
Yeah.
Because us guys, we can't wait to try out the new toys. So whether it's a remote control car, or a trash can, a faucet,
or your new dick.
Yeah, so you totally can. I basically tell people, like, you're gonna have 2 holes or 4 holes in there, and when I say holes, I mean like little
microscopic,
like needle puncture.
But you'll know, like, is it healed or is it not healed? And if it's healed, then go ahead and do whatever.
So do you okay, so let's talk about where you start at, right? Like, okay, 2 things. One, do you
why are you so excited?
I just have questions.
Jesus.
Do you have patients that come in that are uncircumcised?
Yeah. That's a good question. Yeah. So
how does that work?
I would say 50-50. A little bit easier for us to do it if you are circumcised, but it's doable either way. And that's actually a misconception a lot of guys have, because different doctors out there do this different ways, and there are some doctors that won't do it if you're uncircumcised, and they'll try to convince you to get circumcised first, or they just won't do it. We've kind of developed a good way to do it where we can accommodate either way.
Awesome.
That would be really tough as an adult.
I'm sure. So you talked about the injection the injection site, right? You said you can have possibly 2 or 4 or however many. How do you decide how many? Is it based on the actual size of the penis, or is it based on where they are trying to get the actual girth, right? So, like, do you start at the base of the penis and then work your way up the shaft to the head, or like, how? Tell us about this. I just want to know, because I'm really curious how this works.
Yeah, good question too. So basically, where we start injecting is at the tip, actually, not in the head, but
at the tip. So like underneath,
like not in the head, right? So in medicine, we say proximal to the head, so closer to the body than the head.
So like, is it
Okay.
So like I like to call the tip, like I like to call that like the
mushroom.
The mushroom.
Yeah.
So is it underneath the cap? Sorry.
It's like at the stalk of the mushroom is where you're starting the injection. Yeah,
so
just underneath the
Underneath the cap.
at the tree trunk before the branches come out.
So
All right.
So you start there, and then
that is a whole mushroom.
Leah, yeah, I'm showing it. I'm showing a thing. All right. So can you see?
Yeah.
So you would
But
be
that does not
you would
look
be
like...
under here.
No, on the shaft.
Oh, down.
There. No, closer to the head. Right there. That's where we start. And then we inject basically towards the body.
So you go down. Do you go down?
Yeah. Well, I mean, it depends what way your penis. Like, it depends where the guys that's injecting is standing and what direction.
Well, they have to stand up when they're doing it. So this
no, but the doctor's standing. So I mean,
I see.
Penis pointed towards the ceiling or towards the wall. Or
so
whatever.
How does it work on people who penis curves?
You just inject it along the curve.
It's no different.
But to answer your question, like a standard needle, like a 27 gauge needle, can be, I think the longest one you can get is about 1.5 inches. So if you have 4.5 inch penis, then you need kind of 3 holes, right? Because
what? Say that again. If you have come again.
Okay, so the needle,
pun intended, Joel.
Yeah, right. The needle in length is say 1.5 inches, right?
Okay, so 1.5 inches is the needle.
So it can inject filler along 1.5 inches of your penis. So if you had a 4.5 inch penis, you would need 3 needle lengths.
Ooh,
I see.
Right. So you would have to do 3 holes.
So if you had a 4.5 inch penis, so if this was your penis, guys.
Yeah. You would have you do an injection on your left finger, right? And then you would do an injection at 1.5 inches and then an injection at 3 inches.
And here and
right?
here.
And then you would be able to cover the whole thing.
Okay.
Oh, I see, they say.
So along the lines of this discussion, is it do you do like a topical anesthesia? Is it something where it's like injected, like almost if you go to the dentist? Is it a cream that you put on, like if you go and get tattoos? Like, how do you numb?
Yeah, so you can put a topical. Usually we find we don't need to.
Really?
Need to.
Yeah, it's what we do is we put we inject the anesthesia underneath the skin, and that, it'll sting for a second, but as soon as that's done, no one feels anything. So
it's similar to like a dentist would inject in like your gums or something.
It's exactly like that. It hurts for a minute, but it's not the end of the world. And then
it's more in your head, no pun intended.
Right, exactly, but not. And everyone deals with pain differently, but no, there's like huge difference between one person and another, and whether it's a surgery or like a penile injection and how they respond to pain. But I've never had anyone leave the office because it was too painful, and I've never had anyone call me the next day and say it was painful. So it's really a pretty minor thing.
Now, do you use I worked in dermatology, so there's certain things. Do you have a penguin that you use?
A penguin?
You know what that is? Yeah.
No, what's a penguin?
And I don't know if that's just a penguin basically so like if certain people got injectables or laser, and it was basically like a almost like a massager or like something cool where it kind of immediately goes down. Because I forgot that you might know right offhand. I just don't remember the exact science of it. But the brain recognizes one pain at a time or something like that.
Oh, yeah, I see what you mean. Like they'll sometimes spray like cold on, like if you're getting something numb, they'll spray like a really cold thing on it.
So it diverts your attention from,
right?
Yeah.
Yeah, I mean, it honestly is just not it's really not that bad. So these are all things you could do, but I've just never I've never seen it necessary. Now, like I do have, it's called EMLA cream, which is anesthetic cream, lidocaine and prilocaine, but once every 3 months I use it. Like someone will be really nervous and I'll put it on.
Yeah, but I think you guys, the guys that come in there, they want their ego is not in control, right? They, in terms of they have too much bravado to show their fear. You know, their focus is on getting a bigger dick.
I mean, I guess, but I just would think when it comes to guys, because even when I talk about vasectomies of people,
that's
guys,
a whole different story.
But it's a simple process. But
it's
guys,
a different story because we're talking about taking something. We're talking about taking something away as opposed to gaining something to gain something.
Yeah,
you understand?
Yes, but what I'm saying, the conversations that I have had, it's a fear of anyone down there messing with your stuff. So
right.
Even if you were getting the test for STDs, a swab, any touching of your area, guys are like, ugh. So that's why I'm saying, like, oh, I would
again, you're talking about,
but the benefits outweigh.
Absolutely.
All right, fair enough. All right.
Yeah,
So,
like, I mean, guys, for sure, guys come in and they're nervous, right? Most, like 99% of guys are nervous, but I've done 600, 700 of these or something, so I can honestly tell a guy, like, don't worry about it. It's not as bad as you think, right? And I don't think I'm exaggerating or being hyperbolic saying that 100% of guys that leave are just fine with it. Like, it was way better than what they were expecting.
So you're doing God's work and saving relationships across the country, I'm assuming.
I'm not certain he's saving anything. He might be.
Oh, you might be ending them.
In terms of relationships.
Well, like, it's so, I don't know, like, I think women don't care. Like, maybe I'm underselling my product.
Women don't care about what?
Bullshit? Bullshit?
I think women don't care if you have a bigger dick. I think they care if you have a little tiny dick.
Well, let's ask one.
Okay, so I think there is definitely a difference between having a micro penis.
Geez.
Versus having something that can be worked with.
Of course, right.
And I also think that, there's a difference of, I think that as a woman, if you are in a relationship with someone who is not so well endowed and you have very strong feelings for this person,
can overlook
the
it.
size of their penis is not as important compared to how much you care for this person.
Women can do that.
Unfortunately.
Guys probably not so much.
Now, I will say that doesn't mean that they don't have to make up for it in other ways.
Fair enough.
So you know what's funny? Like, we both know exactly what she's talking about. In the moment she said it, we know exactly. So to that point of what she just said, how do you, how would you advise, right? How would you advise a partner to bring up this possibility, right? Because it's I would assume it's as tricky as your spouse is really gained a substantial amount of weight, and it's like, hey babe, would you want to go to the gym together? You want to, you know what I mean? Like, you can't say, hey babe, you gained a bunch of weight, go lose some weight. Like, how do you broach this?
So I just, before I answer that question, I want to go back to something you said about micro penis or like a regular size penis. We're talking here about like cosmetic things. So micro penis is not in the realm of something that we're treating. So any guy that comes and sees us has a normal penis, right? Normal being like on the small side or the larger side, but they're all functionally just fine, right? Okay. But back to your question.
So just to be clear.
Yeah.
Can you tell? I know I brought it up.
Yeah.
What is defined as a micro penis?
Well, a micropenis, by definition, is an actual medical problem where the penis did not develop during like growth and puberty because due to a hormonal problem where like it didn't see enough testosterone.
Oh.
So you essentially have the penis of like
A toddler.
8-year-old or whatever, right? Like it just didn't grow into what it was supposed to. And I suppose there's varying degrees of that, but that's like way different than a guy that just has a small penis that is right. Like there's a kind of a normal range of your penis developed fine, and some guys it's smaller and some guys it's larger versus it just didn't even develop. At which point
and so in terms of size, right, for a micro penis, would we say it's about
like 1.5 inches?
Yeah, like really small. Like think of
like a Vienna
an
sausage.
8-year-old or something like that, right?
Well, so the irony of what he's saying as an example
Like a
and what
Vienna
you
sausage.
literally just said at the same time. Now the visual.
I'm sorry, it's like a Vienna.
It's a Vienna.
I call it a Vienna.
A tomato. So
sure. That's what it is.
Okay. All right. So yeah, you was answering. So before the micro, you was answering something else.
Well, you were, because you had said,
yeah.
I had said like, well, do women really care about, how big your penis is, or to what extent do they care? Clearly they care if it's not usable. Okay. But then it within the usable space, like, is it 5 inches or 7 inches? Like, yeah, I guess 7 inches is better than 5, but I'm not sure that any relationships have ever like ended to someone that, like you said, you care about because your dick was an inch shorter.
2 inches shorter? And I think, I really think it depends. So like if you have a 5-inch pencil dick, that's tough.
Well, we can fix a 5-inch pencil dick. That's that's our specialty. We can make that a Coke can.
Yeah. So, but like if you have a 5-inch Coke can, I mean, if you have a 5-inch Poland Spring bottle, but as long as if my fingers can go around.
Listen,
I'm saying if the lady's fingers can go around it and not necessarily touch. You working with something?
Right. You're gonna have to mute up because I just want to point out, Joel, right, as we're coming close to time.
Coming is what we want to do.
You see, I said I do to this, So
and you did.
Yeah. So she actually spent time ripping the label off because I think that she wanted to show the bottle without having the label, and then she spouts out.
But that's okay.
Okay. I just want to point that out. All right. So, before I want you to give your information and the sense of where people can contact. But before we get to that, there is a couple of questions. There's 7 questions that I want to ask you.
Sure.
One more question.
Oh, go on.
Okay, so we talked about
everything.
The procedure itself. We talked about the maintenance, possibly every 2 years.
Everything.
We did not talk about the affordability.
Oh, does Medicare cover it?
Insurance does not cover it.
Insurance does not.
You might or might not be surprised how many people ask if like insurance covers it, but of course, insurance doesn't care if you have a big dick.
No.
But that can affect people's mental. So I think it's you know what I mean?
Well, it doesn't cover breast implants. It doesn't cover butt implants. It's purely cosmetic thing. I think if you have a micro penis, and you're talking about actual like reconstructive surgery, it probably does cover it.
A little bit different. Yeah. Okay.
That's different than what we're doing.
Yeah.
Yeah. They don't care if you're not happy with your dick size, unfortunately.
Join the club. That's what they'll say.
Yeah, exactly. But no, but people ask us that all the time.
And then what is that?
And so is there a range? Do you have a consultation fee, and what is that? And you don't have to, if you don't feel comfortable giving prices, but like
I think the prices are all on the website. So one of the things that I think we do well is all the prices of everything we do are accurately portrayed on the website, so there's no surprises. So
Wow.
a lot of
Hmm.
a lot of doctors, plastic surgeons, cosmetic kind of thing,
You know,
they'll tell you, yeah, come in for a consult, you can talk to us, we'll see. And then they'll go on Google Maps and look at your house and come up with a price based on like how many square feet or what cars in the driveway and stuff like that. But we our prices are on the internet. It's not cheap. The reason it's not cheap is multifactorial. One is because it's doctors that are doing it, and we put a lot of time and effort into our training and all that. And the other is that the medications that we use are super expensive. In the United States, everything is crazy. Like when you get your lips injected, it's $800 or something, and the actual product that they're putting in costs like $450 or $500.
yeah.
So that's actually a huge part of the expense.
Yeah.
To get to start, probably the lowest amount of money you could spend is about $4,200.
Okay.
And that'll get the average guy about a half inch thicker. About an inch on the average person is about $7,500. And then, just the sky's the limit kind of, but most guys are in the 1 inch, $7,500 type range. We have some things that are less expensive. Like we have a stretching device that we use that can add length, and that's $525. And then we have a Botox injection that's more of a temporary thing, and that's $1,800.
Oh, like if you're gonna have an explosive weekend.
Yeah, well, it's like 9 months, but yeah, like it gives you a little bit of length and a little bit more, a little bit better erection. So it's a little different, but we have something at different price points because not everyone has $7,500.
So you have a little bit of everything for everybody. So let's talk about the Extension Plus package.
Yeah,
That's what I'm gonna call it, right?
yeah. So we have an option where you can just get everything.
Yeah. Let's
Right.
talk about that. How many people come in for that? And how? Okay, so you have what is this thing that you have that stretches?
Yeah, so it's a device called Restorex. It was
Okay.
developed by urologists. It's sold by urologists to treat Peyronie's disease, and Peyronie's disease is curvature of the penis. It's like a medical problem. You can get it for various reasons, and so the stretching device stretches it out and straightens things over time. What they found was that it would, on those people that were using it, it would increase their length a little bit. So the studies showed that they were getting about a 3/4 inch increase, which is actually fairly substantial.
3/4 an inch?
Yeah, like it doesn't sound like a lot, but it's a lot.
No. That sounds pretty substantial.
And that's actually only $525. It's a device. It actually works, but it does take some. It takes time. Like it's not an immediate thing. You have to use it continuously, and there's a protocol, but eventually it ends up that you need to use it about once a week to keep that length increase.
Interesting.
So it's not bad, and it's affordable. And then this one we call it Length X. It's a neurotoxin injection. Neurotoxin being Botox is a neurotoxin, or there's other similar products on the market. So that's injected in there, and that can help with ED. It can help. It can add about 1 centimeter of length, and just kind of make getting erections easier and kind of hanging better all the time, so to speak. Like kind of having a partial erection more often.
Oh, I see. Now,
so it's Leah, you have a ton.
I have a lot of questions.
Well, we need to do part
that
2.
The people need to have answers to.
And maybe you have your girlfriends over.
One more question, maybe 2. Jesus. Okay, so we're going back to the Peyronie's, right? Because
I'm sorry, Joel.
No. This is
good.
This is good information. So in terms of so the curve.
You calm down.
No, I'm really excited.
I guess.
Yeah, I am. And so for curves, right? So how curved are the penises for those who suffer with the Peyronie's disease?
It could be, there's a range, obviously. Like it can be minor to extreme.
Okay, so like extreme.
Well, no, it wouldn't be like
Not that extreme.
180
Like
degrees
this.
or whatever, but it could be like 45 degrees or something. A lot of the times they get it from fracturing their penis.
Yeah.
Too much work.
Yeah, well, they'll like you're having sex and then it
Just the wrong angle.
Yeah, exactly.
Yeah. Come down a little bit too hard.
But that's what the women call Captain Hook. Meg Thee Stallion has a song about it, and she plays it every morning.
Yeah,
I think it depends which way it ends up curving.
Yeah.
Call that nigga Captain Hook.
Because there's nothing wrong with a little curve.
All right, Leah. So
Okay.
I
I just didn't know that was kind of like a deformity.
Is this your?
Because some people are born that way, right?
Well,
Or
you
no?
can have like,
I think
sure, you
everyone-
can have different kinds of curves, but it's like anything. There's a point where it becomes a problem.
Yeah. Okay.
It would depend which way it's curved and how much. Like if it's curved right to left, 45 degrees, that's not going to be as convenient as if it's curved 30 degrees going upwards, right?
Oh, you're saying like if you just got a crooked dick altogether.
Yeah, like say you're looking down and it's 90 degrees to the left. It's going to be
Yeah.
that's an extreme scenario, but
Yeah.
it's going to be
It's like a cane. It's like the top. Yeah. So, all right, I have my things.
Okay,
Are you
hurry
done?
up. Go ahead. I don't know.
No,
but
'cause we're
that's
wrapping
okay.
up.
That's okay.
All right. So the question. So I'm just going to ask these questions, one word answers, right?
Okay.
And you don't have to explain unless you absolutely want to. But it's very simple. But I just want to ask you. All right. So, vodka or tequila?
Tequila.
Club or lounge?
Lounge.
Exactly. Friday night or Saturday night?
It's a tough one. Friday though.
Really? Okay. And this is a wink to I think you will get it. Internet browsing or VHS tapes?
There is definitely some nostalgia there.
Mm-hmm. Uh-huh.
Let's go with VHS tapes.
Exactly. Yeah. Phone sex or Zoom sex?
Zoom sex.
Really? Huh. Okay.
He's more of a visual.
Well,
You just said I don't have to explain. I could just
yeah,
say,
you do.
Yeah.
Drumstick or Klondike bar?
Oh, that's a good one. Drumstick though.
Okay. If you're buying a home, do you downsize or upsize?
You upsize.
Dun, dun, dun. All right. So I purposely, sometimes it can be a little cheesy, but I wanted to end it that way. So I want you to just take this time. We will be quiet. Please give all of your information because I think this conversation was unbelievable and informative. And I want people to know how to contact you directly and how to find out more. So we'll be quiet. We'll mute up.
Okay. So upsizematters.com. If you go to the website there, you can send a text message by just clicking on text us. You can click on call us and it'll call us, or you can fill out a web form and we'll get the web form inquiry. We have 2 guys that answer the phone, answer the text messages and the web form submissions. They're in the United States. They know everything there is to know about this. They're great guys. They'll talk to you for an hour if you need to and answer all your questions. There's no charge for that. And when you're on the website, you can also go to the Doctor Finder tab and you can choose your city and kind of learn a little bit about the doctor that's nearest where you live. But definitely go to the website and send us a message and you can talk to one of our guys and they'll answer all your questions and get you booked.
And thank you for that. And I want to just put it out there because typically guys will get in trouble in most other spaces. But this is the one space where sending dick pics is not offensive.
Well, do you send them? Do you like?
I think that
I don't know if that's part of the consultation.
But you have to see photos before.
I don't know if that's how do you do the consults? Do you do them?
So, the question you have to ask is it necessary to get the dick pic, or can it wait until you just come to the office?
Yeah, man.
Fair enough. Sometimes
you got to keep in mind that like our guy, it's probably 8:00 at night and he's having ice cream with his family, and then the dick pic comes in, right? It's probably
definitely not. Yeah, man.
It's probably not exactly the thing he's hoping to see, but we do get them, and the response is we can't accept images on our text messaging system,
because that could be considered like still like
porn.
It's just we get it. We've seen a dick before.
Yeah, but right. it still be considered
like lewd behavior.
Yeah, like
all right,
God, you know what I'm trying to say.
No, we don't.
Yeah.
All right,
you know what I'm trying to say.
We'll take a look at your dick in the office. No problem.
Yeah, man. Exactly. Don't try to send the people to tell the things like that.
So thank you so much. This was unbelievable, and I would love to have a part 2 to this, because I think my instincts is once this comes out, there's going to be some questions and some comments. So I would love to like revisit in the future and have another conversation.
Sure.
And I actually have a really interesting idea of like having a conversation, and I'll ask you first before I just kind of arrange it. But I have an idea of kind of putting something together. It will be really fun.
Last question, because I'm not going to search this up, but I'm just really curious. Where are your offices located, or the doctors that you are affiliated with located in terms of Upsize?
Good. Okay, good question. Sacramento, San Francisco, Los Angeles, Phoenix, Austin,
Texas, California,
Cleveland, Ohio, Miami, New York City.
Okay.
New Jersey.
Okay.
We have 2 in New York City, 1 in New Jersey, and Raleigh, North Carolina. Omaha, Nebraska is our newest one.
Wow.
That's interesting.
And we have our first clinic in Canada coming online, which is in Edmonton, Alberta, Canada.
Interesting.
Wow. Okay.
Oh, and we have an affiliate in Panama City.
Panama. Yeah. Nice. Okay.
So you're not New England yet.
Not New England, but
not New England, but
close,
if you're in Panama and you need a bigger dick, you
East Coast is good. You're on the East Coast, the West Coast. You know that works.
Yeah.
Oh my goodness. Okay.
All right, Leah. Write your questions down and
oh hush.
All right. So we'll be contacted, because this. I'm gonna hear about this all night now. So thank you. I'm sure I'm good, because you're just like revved up and ready to go.
Am.
I know.
I am.
Well, hopefully never.
You know, there's a friends and family discount for podcasters.
I love it.
Can you create curvature when you're enhancing the size? No.
We can have you bring in a model, and we'll no, I'm just kidding.
Nice. Very nice.
You almost had me sold. No, just kidding.
Nice. Well, so thank you again, Dr. Joel Pash, for spending time with us on Wedlocked and Loaded. Unbelievable, informative conversation, and I think it's important for men to know their options also, because women are dominating the space of making their improvements, and we need to get in on it also. And it's not all medically necessary. It's okay to have cosmetic enhancements. So thank you for having this discussion with us.
How you throwing it?
Lit. Oh my God. Anyway, so this has been another episode of Wedlocked and Loaded. We will see y'all next week. Same bat time, same bat channel.
You
gotta say
thank you.
You gotta say
thank you.
Oh my God.
We're locked and loaded.
Wedlocked and loaded.
Wedlocked and loaded.